Well, the positivity rate of COVID cases in Duval County is close now to 35%, according to the latest numbers from the Florida Department of Health. But during flu season, it can be hard to figure out why you don't feel well. You think, oh gosh, do I have COVID? Do I have the flu? Do I have a cold? Do I have like several of them at the same time? On your side's Kaylee Tracy talked to local healthcare professionals about how to spot the difference and figure out what the problem is with you.
If you have symptoms of an upper respiratory illness, it is very hard to know whether it is COVID or the flu or the cold from looking up different symptoms in a textbook.
The symptoms are similar, to say the least.
Runny nose, cough, headaches, fatigue, body aches.
There are some nuances to each, though. For example, loss of taste and smell are hallmark symptoms of COVID. Chad Nielsen, Director of Infection Prevention at UF Health Jacksonville, says Nielsen and Dr. Shalika Katugaha of Baptist Health say getting tested is the best way to figure out which illness you have.
When it comes to COVID, flu, cold, allergies, we can't just look at someone and say, okay, this is what you have. What we have are the tests. And that's why it's so important to utilize them.
If you can't find a COVID test, Nielsen says use process of elimination.
Do a flu test at the doctor's office. If it's not flu, but it still is a viral infection, it's likely going to be Omicron COVID at this point.
Nielsen says if you start to get cold or virus-like symptoms, get tested. Odds are it's COVID.
There are still viruses floating around out there, cold viruses out there. There is some more influenza activity right now than we've seen in the past. But by and large, it's Omicron COVID spreading right now through the community.
And yes, it is possible to get COVID and the flu at the same time, although they say they haven't seen a large number of cases of what's called flu-rona. Both Katugaha and Nielsen say get vaccinated for the flu and for COVID because you're more likely to have mild symptoms if you get either illness. Kaylee Tracy, First Coast News, on your side.